seated flexion test, easy to find, right? I'm on the PSIS. Make sure that he's kind of pretty close to the floor, so he doesn't face plant on the floor. Okay, so what you're going to do, David, is you're just going to slump forward, bring your hands between your knees as if you're touching the floor. You can put the hands behind the head either, but that's fine, right? So what you're looking for here is an uneven, the same thing you're looking for. Okay, and come up again. And we go again there, see if we get anything different. Okay, come up. And what you might get is a positive on a standing and a negative on a seated. What does that mean? So the theory behind this is that in seated, your ischial tuberosities are on the couch, so it now fixes your pelvis and limits, not completely, but it very much limits your innominate rotation. So now what happens is you get the spine flexing and the sacrum, a little bit of joint play, and then the sacrum will engage with the ilium and it will eventually lift the PSIS a little bit on both sides. But if the sacrum is fixed on the ilium, it will engage early and the PSIS on the dysfunctional side will rise.
So it's more awkward seated.
What?
More awkward.
No, it's not. It's just different types of dysfunction. So when it's a standing, you'll call it an iliosacral dysfunction, and when it's seated, you call it a sacroiliac dysfunction. What you'll do is you'll do both. You can do both tests. If the iliosacral is positive and the sacroiliac is negative, it's an iliosacral dysfunction. If they're both negative, it's negative. If the iliosacral is positive and the sacroiliac is also positive, it's a sacroiliac dysfunction. The sacroiliac trumps the iliosacral.
Okay.
You call it a sacroiliac dysfunction. It can be a bit of a pedantic argument. You can just say, like, if the joint is locked, the joint is locked, regardless of whether the sacrum is locked on the ilium or the ilium is locked on the sacrum. But it does allow you to get a little bit more of a specific diagnosis. I'll talk a little bit about some of the sacral dysfunctions, but I won't go into it in this course because the sacrum in itself does wild things. You know, it rotates on different axes. But I'll talk a little bit about it and try and simplify it enough that you know enough about it to be able to apply the techniques.